Now coming to the next bone, that is the occipital. So this is the occipital bone. Okay. This is the occipital bone that is formed by the fusion of the three parts. One that is known as the supraoccipital or the squamous part. Then we have this one that is known as the lateral part, and then we have this part that is known as basilar part or basioccipital. This is the lateral part or lateral masses or ex-occipital. This is that is supraoccipital or that is the squamous part of the occipital. So this is squamous part, this is the lateral part or the lateral masses, and this one that is the basilar part or basioccipital. Here in this skull you can see this is the skull of the cattle. So here you can see, easily you can see from here that this is the supraoccipital or the squamous part of the occipital bone, and this one that is the lateral masses or the lateral part or ex-occipital, and from here up to this part that is known as basilar part or basioccipital. So coming first to the squamous part of the occipital bone और supraoccipital को हम पहले डिस्कस करेंगे. This is the squamous part of the occipital bone. So this is the part that is located above this is the foramen magnum. Above the foramen magnum जो part होता है that is the squamous part or supraoccipital. So this squamous part, it is just before the birth, it gets fused with the parietal interparietal bones. ठीक है. So it presents two surfaces होते हैं इसमें. This is the external surface and have got this internal surface or the cranial जो इस side होता है, that is the internal surface or the cranial surface. This is the external surface. So on the external surface centrally you can see this is क्या है यहाँ पे, there is a protuberance that is known as external occipital protuberance for the attachment किसके लिए, for the funicular part of the ligamentum nuchae. So the funicular part of ligamentum nuchae, it is attached here with the external occipital protuberance. From the external occipital protuberance ventrally, here there is a crust that is called as median occipital crust. This is median occipital crust, and this squamous part of the occipital bone, ये क्या होता है, this dorsally it joins with parietal and interparietal, and laterally it joins here with the laterally किसके साथ, that joins with the temporal bone. ठीक है. So laterally it joins with temporal and dorsally with the parietal and interparietal. ठीक है. So ये इसका this is the external surface, and opposite to here this internal surface or cranial surface. Internal surface or cranial surface, it presents a depression or a fossa. Here यहाँ पे एक fossa होता है. See, you can easily feel with the finger. अगर आप यहाँ से finger डालेंगे तो easily यहाँ पे एक fossa है यहाँ पे for the vermis of the cerebellum. ठीक है. Just above the fossa there is another protuberance that is called as internal occipital protuberance. ठीक है. यहाँ से अंदर से on the cranial surface for the इसके साथ for the tentorium cerebelli. So here on the internal occipital protuberance tentorium cerebelli is attached, and for the external occipital protuberance the funicular part of the ligamentum nuchae is attached. ठीक है. So this was about this is the squamous part or the supraoccipital part. Now coming to the next part, that is the lateral part or the lateral masses or the ex-occipital. The lateral part or the lateral masses or ex-occipital that consists of, इसमें क्या क्या होता है. First, this is the foramen, the second largest foramen, that is foramen magnum, through which the spinal cord that leaves from here, that is foramen magnum. Then we have the condyles. So consists of foramen magnum, condyles, and this is the paramastoid process or paracondylar process. So तीन parts आते हैं. What is foramen magnum, condyles we have, then we have the paramastoid process. So these are the two condyles. They are located on either side of the foramen magnum. ठीक है. The articular surface of the condyles, ये क्या करता है? They articulate with the atlas. ठीक है. So if you can see that each condyle that is divided by a prominent ridge into two parts. So this is the upper part and this is the lower part. So this is the convex lower part. It's also convex in nature. ठीक है. These two condyles, they are just above, they are located wide, and below they are located, they are close to each other. ठीक है. Above they are wide and below they are close to each other, and they are connected by an intercondyloid cleft. ये intercondyloid cleft है. ठीक है. So these are the condyles. They articulate with the atlas on either side of the foramen magnum. ठीक है. Then coming to the third part, that is the paramastoid process or paracondylar process. These are the two processes. They are located on either side of the condyles. ठीक है. So this is the paramastoid or paracondylar process. So they are separated by this depression that is known as condyloid fossa. So where we have this space or a fossa that is known as, इसको हम बोलते हैं, that is known as condyloid fossa. ठीक है. Condyloid fossa. Each paramastoid process, it has a base that is wide, and here it has an apex that is pointed. इसमें ये है नहीं टूटा हुआ, लेकिन जो apex होती है that is pointed and base that is wide. The two surfaces are there. External surface that's convex, और क्या होता है? Internal surface that is concave. This is paramastoid process or paracondylar. There is a fossa that is known as condyloid fossa. ठीक है. इस condyloid fossa में क्या होता है? You can see there are two foramens are there. The one foramen, you can see here, the one foramen that is, ठीक है, you can see one foramen here that is located close to the border of the condyle, that is called as hypoglossal foramen. You can see from here, this is the hypoglossal foramen, and just above there is another foramen that is known as condyloid foramen. So hypoglossal foramen से क्या होता है? वहाँ से 12th cranial nerve, that is hypoglossal nerve पास होती है, and this condyloid foramen it is often double. तो यहाँ से क्या होता है? यहाँ से एक vein पास होती है. This condyloid foramen it leads into a canal that is called as condyloid. Medially ये run करता है. You can see वो अंदर तार चली गई है इसमें. So it leads into a canal that is known as condyloid canal. ठीक है. That condyloid canal it terminates into the temporal canal. ठीक है. जो टेम्पोरल कैनाल जो यहाँ से आता है उसके साथ ही ज्वाइन करता है. ठीक है. टेम्पोरल कैनाल जो होता है उसके साथ ही यहाँ से दिस कॉन्डिलाइड कैनाल टर्मिनेट्स ऑन द टेम्पोरल कैनाल. सो दिस वाज ऑल अबाउट द सेकंड पार्ट दैट इज नोन एज लेटरल पार्ट और द लेटरल मासेज. नाउ कमिंग टू द थर्ड पार्ट दैट इज नोन एज द, इसको क्या हम बोलते हैं? दैट इज the basilar part or basioccipital. The basioccipital extends from this ventral margin of the foramen magnum, and it forms the base of the cranial cavity, that is the floor of the cranial cavity. क्या बनाता है? Floor of the cranial cavity बनाता है this basioccipital. So it extends from the ventral margin up to the, कहाँ से? Up to this is the post sphenoid, that is the body of the post sphenoid. So anteriorly it joins with the body of the post sphenoid, and when it joins with the body it forms, you can see at the junction there are two tubercles present. They are known as उनको क्या बोलते हैं, दे आर नोन एज बैसिलर ट्यूबरकल्स, दे आर नोन एज फॉर मस्कुलर अटैचमेंट. ठीक है. सो दिस fusion it is complete in case of the adult. So basi-occipital and the post-sphenoid के बीच में this fusion it is complete in the adults, while as in case of the young one it is held by joined by cartilage that is called as synchondrosis. ठीक है, उसको हम बोलते हैं synchondrosis. So this is the basi-occipital or the basilar part of the occipital bone. ठीक है. So this is the body of the post-sphenoid, and here these are the basilar tubercles anteriorly, and laterally it is related with, this is the auditory bulla or the tympanic bulla, you can see on this side of the petrous part of the temporal bone. ठीक है. And plus here you can see it forms the basilar part forms the medial boundary of the foramen here, that is called as foramen lacerum. So here you have a foramen that's called as foramen lacerum. So through which 9th, 10th और 11th cranial nerve passes. यहाँ से 9, 10 और 11 cranial nerve जो होते हैं वो यहाँ से पास होते हैं through foramen lacerum. ठीक है. And on the cranial surface of the basi-occipital, the medulla oblongata जो होता है that is placed on the cranial surface of basi-occipital. ठीक है. So this was about the ये occipital bone के बारे में. So 3 parts होते हैं. One is the squamous part, this is the lateral part, and this is the basilar or basi-occipital. The lateral mass or occipital, and this is the squamous part or the supraoccipital. So thank you very much.